Sepsis is basically when an infection of usually bacterial, but it can be fungal also, which can overwhelm the body and therefore spread a lot of toxin across the body and overwhelm the body's immune system and its defenses, thus causing a sort of an inflammatory reaction, a severe inflammatory reaction, which then goes on to become sepsis or septic shock. So when the body's defenses are overwhelmed, it is trying to fight the infection, but the infection is there are toxins produced, and there are some changes that are happening in the blood vessels. The fluid from the blood vessels is leaking outside. The blood pressure is falling, especially when the blood pressure falls below a certain level where the urine output of the person is not being able to be maintained, where the perfusion of the peripheral organs is not being able to maintain, meaning the blood supply to all the vital organs is not being able to maintain. That is when we say the person is in septic shock, which is a critical emergency and it is fatal a lot of the time. But early sepsis, where the infection is starting out or where the toxins are spreading, the body, we can still salvage the patient very easily by certain treatments. Basically, it is an infective process which then gets overwhelming for the body. The early signs and symptoms are that the patient starts they may or may not have a fever, but they start feeling very weak. When the blood pressure comes down, they start feeling very weak. The skin and the limbs will feel a little flushed, red, perhaps, and they feel down. They want to lie down. There may be, once you start looking at the blood tests and all of that, there will be signs and symptoms suggesting of infection. There may be some localized of signs of infection, like for instance, if there is a urinary infection, there may be some urinary symptoms. A chest infection, there may be some chest symptoms. If there is an abdominal infection, maybe they have abdominal pain or difficulty in passing motion or excessive stools like diarrhea. Any of these focal signs and symptoms can be there to suggest where the infection is coming from, or a general, very profound weakness can be there, which then suggests that there is something wrong and the blood pressure is down. There's something wrong. It might be an infection. Almost everybody that can get an infection, that is, all people, human beings are actually at a risk for sepsis if the infection is of such a nature or which continues for such a long time that the body's immune functions or immune system is overwhelmed. But having said that, certain people, as we may have understood from recent pandemic and discussions around it, are much more vulnerable than other people. Like for instance, young children, older adults over the age of 65 or 70 now, or people who are otherwise immunocompromised because of medical problems like diabetes, kidney problems, heart failure, or people who have cancers of various kinds and therefore are on chemotherapy, who are on other immunosuppressant medications, meaning medicines that reduce their immunity, like steroids, for instance, but for other reasons. So people of all of these sections are far more vulnerable than a regular person to the complications and the problems of sepsis. Major complication of sepsis is that it can be fatal if the person goes into what is called septic shock. The septic shock is when the blood pressure has fallen to such a level that it is not getting, just fluids resuscitation is not helping it come back up. And sometimes we have to place this person in the ICU. We have to give them various kinds of, very advanced medications to help hold the blood pressure up. And sometimes, despite all of these measures, we may not be able to keep the pressure up while the antibiotics are acting, while the infection is being, controlled, and it can end up being fatal. Once in the septic shock stage, it can be nearly 30% of the time it can be fatal. Other than this eventuality, most sepsis, if it is coming under control, usually the patient recovers very well. Certain vulnerable people, again in the older age group, if they have borderline kidney function, borderline liver function, sometimes can have a worsening of their liver disease, worsening of their kidney disease after an episode of sepsis. But should one be recovering, it is if they are able to be salvaged well through the various kinds of treatment, then usually the recovery is near complete. It is a sort of a collective diagnosis for various infections, but it is also a specific diagnosis of a certain level of infection. Meaning, if I have a urinary infection, I'm not septic. But if I have a urinary infection which my body is not able to, take care of, and then it goes into my blood, the bacteria have gone into my blood, there they have produced toxins, and that is causing a lot of havoc around my, around the whole body with the blood pressure coming down and I'm going into shock. That then is sepsis. So it is not that we just identify where the infection is coming from, although that is a very important part of it. Identifying the source of the infection is a very important part of identifying the septic process also. Once we identify the source, we then attack the source of the infection as well as understand the degree of sepsis. How much has the body been affected by this particular infection is a very important aspect to understand. Once we understand both aspects, we can treat on both the lines and be able to help the person recover from it. Largely, once the patient is understood to have sepsis, one, like I said, we must understand where the source of the infection is, whether it is urinary, chest, abdomen, any abscess anywhere in the body. Any of these things can be the source of the sepsis. One big part of the treatment is source control. So if there is an abscess in the kidney, we must address that, even if necessarily surgically. If there's an abscess in the abdomen anywhere, we must address that. We must address the chest infection. If while we are treating those with antibiotics and local treatment, which may include surgery, we must treat sepsis also, which is the inflammatory process in the body that is going on as a result of the infection. So one part is to treat the source of the infection, and the second part is to treat the overall body by supporting it. Supporting it how? We give IV antibiotics, of course. Along with it, we give lots of IV fluids to be able to support the blood pressure and maintain the blood supply to all the vital organs and support the body while we are also treating the source of the infection. So the main pillars of sepsis treatment are these aspects. There are certain specialized medications which we sometimes use to support the immune system also. Early recognition of signs of infection is the primary mode of preventing sepsis. Once the person has gone into sepsis, their criticality increases a lot. So it is important. So sometimes somebody has a cough and a sore throat and is getting a fever. To prevent that getting worse, we must recognize or understand what is causing that and treat it at an early stage. Choosing now, a lot of discussion is there about when to give antibiotics. So that is a critical understanding to have, where you have to understand that you must not treat everything with antibiotics. That is for sure. Like every cough does not require an antibiotic. However, when the person is recognized as being, infected enough, especially with, bacteria and sometimes with fungi, it is necessary to give the antibiotic or the antibacterial to be able to prevent worsening of that infection. When the urinary infection requires an antibiotic, when a kidney abscess needs urgent and immediate drainage, these are decisions one has to collectively make. You must usually use the help of a doctor, and the doctors that sometimes will use the help of other specialists also. So a physician like myself, while understanding how to treat sepsis and how to prevent sepsis, would also like the help of a urologist or a general surgeon to be able to deal with any of the abscesses or kidney infection or anything that may be that we may be observing in the particular patient. So it's usually a teamwork that is required to both prevent and treat sepsis. You must recognize the infection early, treat with antibiotics early, only in the pertinent cases. But the recognition of these pertinent cases is the key to preventing sepsis.